Okay, so I want to talk about how doctors are overpaid snobby people. Okay? Is anyone else tired of snobby, overpaid doctors? And yes, doctors are overpaid, and I mean all doctors. Okay, so doctors were basically highly paid because they were walking medical encyclopedias. Okay, they had to memorize these symptoms, memorize those collections of symptoms and how they correlated to different conditions, and they had to sort of memorize images or observe them in clinicals and that type of thing. Okay, but that is no longer relevant because everyone's a walking medical encyclopedia. Everyone's a walking medical encyclopedia because we have access to the internet and typically via our smartphones. That whole sort of reason for their high pay has just been rendered highly irrelevant. It kind of took that kapow out of it, right? Because let's say something like I can diagnose myself. I can recognize if I have say something like pink eye. Yet when I get pink eye, I have to go through these manufactured gatekeepers, these monetized gatekeepers for treatment. I have to sit in that medical chair and listen to this doctor tell me what I already know because they're doing the same thing that we can do now. That's all they're doing. They're observing symptoms. Like I can I'm experiencing my symptoms. Like that's what we tell the doctor. Like, what are you experiencing? We tell the doctors our symptoms and they observe what's happening. Okay, well, if I can tell you if that's the information that you're using. So I know tell say my symptoms to myself, Google them, look at a picture. Oh yes, it's pink eye. So why do I have to go through to this monetized gatekeeper, which is manufactured, by the way? It's this is all made up. It's just one construct, it's just one way of doing things. And clearly there's a sort of sinister sort of basis foundation for the system. Okay, it's this sort of forced relevancy. It's this forced monetized gatekeeping. Okay, that's basically what a degree is. These college degrees are like intelligence permission slips. We don't need we don't need permission slips to be intelligent. That's what 80% of the doctor being about, that's what 80% of the pay was about. Being a walking medical encyclopedia. Everyone's a walking medical encyclopedia. Okay. And then yes, there's some people. This is sort of is a more logical, can sometimes be a more logical. Uh, there's aspects of like a logic. Yes, there's some people with maybe most of us have enough logic to figure out the basic things, the common things. Now, I'm not saying like for extreme cases and things like that, that, oh yeah, I can figure everything out. I'm not saying that. I'm not saying sort of phase out doctors completely, but common things, basic things, yes, we can figure it out. Yes, you can figure out. The average person can figure out if they have chlamydia. Okay. Yet we have to go to a doctor, go through this whole routine to have something, this doctor tell us what we could have figured out, what we knew, what we could have figured out ourselves. Okay. Um, like it will almost be like I don't think high school should exist, but a high school diploma should be enough to say that's like a pass that says, okay, you can treat yourself for common basic things. But these sort of, let's just call them castes, right? The academia caste, the STEM caste have rigged society to make us sort of, it's this forced dependency where even the minutia, most common sense things, we have to go through them to treat ourselves. It kind of reminds me of that thing where people fought to repair their own tractors. It was illegal for people to repair their own tractors. They run this right to self repair case. Okay, they just did that to like right. They it was this forced middle person, this forced middleman, this forced middle person. It was this enforced gatekeeping, just so you had to go through them. It's all profit driven, right? It's exploitation. I mean, that's one reason not to have faith in the legal system at all. Clearly, not an effective, broken system. But it's the same thing. We need a self to a right to self prepare to self repair. Okay, and people are going to be have issues like, so what if that pink eye reached this stage where it's not your typical pink eye? Okay, it's not your common pink eye. It's not your typical pink eye. It reached this stage, or it caused this damage, or this, that, and the fourth. That doesn't matter. Yes, self-diagnosing without a sort of a medical degree, this, that, and the fourth, could be um, dangerous, but whitewater rafting is dangerous. Boxing is dangerous. Think of these like very dangerous sports and activities, riding ATVs, like the very dangerous sports that we let people do. Okay, why whitewater rafting can be very dangerous. Um, Rock climbing, whatever you want to say. Whitewater rafting can be very dangerous. Why do we let people do it? Shouldn't we make everything that's dangerous illegal if self diagnosing yourself can be dangerous? We let people do it because it's their business. It doesn't hurt anyone. But them, the potential only is to hurt them. We call it a victimless crime. If you, a person, if someone dies whitewater rafting or seriously injured themselves whitewater rafting, it was a victimless crime. It was a non-violent crime. It was a victimless crime. If I lose my eye because I like misdiagnosed or mistreated my pink eye, it's a victimless crime. If me self-diagnosing myself, if me self-treating myself is simply illegal because it may be dangerous, then make everything that's dangerous illegal. Like, let me see most dangerous sports. Like NASCAR, that popped up. Make NASCAR illegal. Um, my internet's acting wonky, but I think people would get the idea. Anything that's particularly dangerous, make it illegal. Otherwise, what's the issue? What's the problem? That's my prerogative, and then I'm not exactly concerned about that. And then that's no different. You would literally that the same thing would play out with doctors. It typically plays out the same way with doctors. Um, I would treat myself, and then I would realize something's wrong. They were like, "Oh, it's pink eye," and then you would leave, and then you would realize something's wrong, and then you would just go back. Okay, then I would go to a doctor. Like it plays out in the same way. Basically, you're typically telling them your symptoms. They go off of that, but then that's getting into like doctors' due diligence. Yes, but still, very common conditions, very common issues, afflictions, we can figure out ourselves. Like I saw people taking their kids to the doctor because they have a cold. Didn't we used to just like let them stay home from school and give them chicken noodle soup and some vapor rub because we recognized that it was a cold? But now every little thing we've been sort of conditioned to be hyper dependent on these medical professionals, sort of outsourcing our own intelligence. Like, say you let your kids stay home, you're like, oh, they have a cold, and it gets worse. So you would take them to the doctor because if you took your say that you think your child is sick and you think it's a cold, but you take them to the doctor anyways. What are they going to say? Oh, it's a cold. They're not going to do anything super extra or particular. Okay, but then we're even getting to the thing where we should have access to, like, because basically doctors are overpaid test result readers. Because what do doctors do? What's the hard part about being a doctor? What's the hard part? And let's take out just surgeons out of this for a second. Take out surgeons. What's the hard about part about being a doctor, especially this diagnosis thing? What's the hard part? Like, there's nothing extraneous about it. There's nothing difficult about it. Like, it's not Grey's Anatomy where it's going to be this unique, rare condition or issue. Most of the 90% of the time, it's going to be these 10 to 15 very common conditions, issues, or afflictions. Even like in a car accident, like, oh, he has a skull fracture. That's easily recognizable. It's very common. It's very type of thing. But even the most, and then these other doctors where you just go a general practitioner or like these other issues, you go to like a random doctor. It's like that. There's a scale, but I'm mostly talking about like when you have like pink eye or this or that, you go to the doctor, or just for a general checkup, you go to the doctor. 90% of the time, it's 10 to 15 very common, easily identifiable things. What was hard about that? That's what doctors mostly do. What was hard about that? Or even specific doctors go to a podiatrist, it's going to be 10, 15 common, very, very common things. What was the hard part that the doctor did? Why are doctors paid so much? What's the hard part about it? It's like this almost this retroactive entitlement pay because what it took so long to be a doctor. Um, that's artificial. That's made up. If you take all these fluff and filler classes and nonsense, uh, those classes that have nothing to do with being a doctor, these mandatory classes, these classes that could have been an hour of reading, a couple hours of reading, but you extended it to three months, right? These artificially extended classes, these classes that could be like merged, three classes that could be merged into one class. You could become a doctor in a fraction of the time. Okay, like and cut in half. Like school's already super repetitive. Like it just makes no sense. Like like everything should be a trade school. Everything. College should be abolished. everything should be a trade school, including a doctor, because why not? What is that? What is history or fine arts or that yes, that's a medical class, but you know that could have been 2 hours of reading. Like you just extended it, right? It could be a fraction of the time, right? Uh, so no, you're not justified to have paid because it took so long to be a doctor. That's made up. That's just its own signature motives. That's just, you know, extending the product of the college education and creating jobs for teachers. Okay, and even like those important classes, let's not pretend like that had to be 3 months of class. Okay, let's not pretend. And then you guys pretending like you don't rely on the internet anyways. You just Google it. There's people who like I read a lot of like doctor comments, from doctors, and they talk about how you guys will Google something. Like I could have done that and save a couple $1,000. So like, what's the hard part about being a doctor? Okay, so and then even with the things that say those uncommon things or you have to figure it out, people will say that's what they figure it out. No, most of the time they're not figuring anything out, and then we could easily figure it out. But say those uncommon things, something they have to figure out, or it takes an um, extra activity. Like I'm gonna get some panels and this test for that pink eye. That looks a little bit whatever. Um, that's not hard. That's like these. It's like these logical activities. But these doctors were born with a higher average in logical intelligence. That figuring it out is like flying through hoops. But these doctors are birds. Like some of us are like wolves or fish. So figuring it out is more difficult for us. Like a wolf could jump through a hoop. It's going to be more difficult, but they can do it. But your bird, it's not hard. It's almost like you would do it anyways. Like it's not. There's nothing extraneous happening. You're a bird flying through a hoop. It's like having a job. Your job is to swim, but you're a fish. You're basically not doing anything. You were just born. You were born and could afford medical school. Now you're a doctor. What's the hard part about being a doctor? It's those very rare cases where you're like really crunching and and then that has accumulated where even those rare cases are Googleable, and where it happens where sort of medical testing like blood tests and these other testing is getting so advanced. Even that's not you're not it's not a puzzle. There's no puzzles anymore, right? That's what being a doctor was, these sort of logical puzzles. These difficult puzzles are few between. Like they're very rare, and then it's almost off to say very difficult because it's a logical thing, but you were born with very high logical intelligence. So difficult difficulty around being a doctor is no. It's like not a thing. Okay, it's not a thing. The the hard part about being, or you could say like, so let's look at. There are some difficulties of being a doctor, but first, there would be a lot less on your plate if we were empowered to self treat ourselves. That's the first thing. Okay. But the most difficult thing about being a doctor, it seems to just dealing with us. Yes, I know we can be very needy and demanding people. We can be spoiled and entitled ourselves, right? That sort of social work, in a sense. But then that is your problem. That's your creation. The supply of doctors is kept artificially low, so you can have that's how you get that's the sort of justification or the reason for your very high pay, that you are so in demand. Okay, but the supply of doctors is kept artificially low so you can have that high money, right? What's like the typical ratio per doctor per page per patient, like especially like in hospitals? What is just around the numbers to throw out, like one doctor to 30 patients? That's completely artificial and manufactured so you could have higher pay. Maybe it should be like one doctor to five patients, which is possible. We can do anything, first of all. But you want it this low supply of doctors. It's artificially kept low. We could make becoming a doctor free. That's like a barrier to becoming a doctor. Let's make it's free. Would you pass these tests and criteria to or you would be a very good doctor? Okay, here's a free medical education subsidized by the government. We can make acceleration programs. We can convert malls into like mock hospitals and doctor schools, doctor trade schools. We can do anything. But you what you want is you want everyone, not just doctors, is like this thing in our culture. Everyone wants something for nothing, right? Like that this gets into like the rude, arrogant, snobby part where you guys are who has experienced like those dismissive doctors, those doctors that rush you. You feel like an appliance on a conveyor belt where they're just woof, 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 go, go, go. They want to get you in and out. They treat you like an inconvenience, right? That's because doctors don't like us. They feel like we're needy, almost like in that energy vampire way. But that's your fault. Like you want the high pay from the artificial doctor supply, but you want none of the sort of the consequences or challenges from being one doctor to 30 patients or to 50 or whatever it is. You want it all. What's that saying? You want to have your cake and eat it too. Pick one, because then it's not like your job is hard anyways. That's the only hard part, which is artificial. So you can have high pay for practically doing nothing. Like this is so ridiculous. It's like this proves like logical intelligence is just one type of intelligence. There's actually multiple types of intelligence because you guys could have like there's like no strategy here. Like you guys could have made some concessions, made it a little bit better, and have gotten away with this overpaid thing for even longer. But we're only realizing like you're driving us to figure this out. You have turned us into like ponderers and detectives. You made us ask what's going on, what's happening, and then we sort of opened Pandora's box. You drove us to this. Like this is a rigged system, so deeply corrupt and rigged. Like who agreed about the insurance? It's made up. It's created. It's an imaginary construct. Who agreed? I didn't agree to this. Who said that my money should go to this or to that? You guys have forced yourself as gatekeepers. How can I not treat my how how is it possible I can have pink eye but I can't just simply go get medication and treat my pink eye? Why do I have to jump through all these monetized hoops to do it? Because of something this made up structure in our society. It's made up. Okay, so it's the how do you guys have the audacity to be so arrogant and snobby and dismissive that we're this severe inconvenience to you? And then on top of all that, you guys make it's actually common for you guys to make mistakes. So it's like you want to treat your own self. Why not? They misdiagnose, they dismiss it, they minimize what you're going through. Do not mention that you have pain. If you're in severe pain, do not mention that you have pain if you go to a doctor. Unless I guess I know it's different for the higher income you guys have a different experience. But once you hit a certain income bracket, don't mention that you practically cannot mention that you have pain, even if you're in severe pain, because they treat you like you are some like addict who's like trying to score a fix, or like you're some cabal, part of a cabal where you get to sell it. Doctors instantaneously dismiss and minimize pain just to protect themselves. For what? If Why do pain medications and relievers exist if you're not going to prescribe them? If you're so afraid of that having some type of blowback on yourself, let's why are they so heavily policed and gatekept? Because they're dangerous. Okay, if they're so dangerous, make them all illegal. Stop producing them. And then who cares if they're dangerous? Whitewater rafting is dangerous. Let people do whatever they want. It's better to let people do whatever they want, so those people who have genuine and authentic pain are getting relief. What's it to you? Oh, because it's all about profit and gatekeeping, which you've been getting away with because um, you have this sort of cult. There's people who you guys blindly trust doctors. Why? It's just a profession. It's kind of like how people approach priests and all these other clergy. You could be like a serial killer, murderer, rude, toxic, horrible person, and it's like, I want to be a priest. And then you just, it's like a job, it's a profession. You become a priest, and you put on, and once they put on that costume, people are like, you assume that they're good people. It's just a job. Why does that magically make you a moral person? It's no difference. You just decide to become a doctor and you become a doctor. But you guys have this blind trust with them, even though there's this horrible, horrific track record around the medical industry and these STEM professionals and these academics. Horrible, horrific track record. Locking women up for female hysteria, lobotomies, saying that gay is a sickness, and performing electroshock therapy, the Tuskegee experiments, like all the mistakes and like um, all that type of thing. It's just a person. It's just a job. What it seems to be is like it's like this. I think it's like academia occultism, where like let's say like NBA fans, hardcore NBA fans. If you could treat or judge anything about the NBA, people just are blind to it. They deflect it. They defend it blindly, just because they're associated with it. So I guess because these people are like sort of academia castes, like there I guess there's like a hierarchy within these academia castes, and like STEM is like the top. They I guess they're like your idols or something. So you're like, and because you also have a degree, it's like this cult blindness, this tribal blindness. But who cares? They're just people. Like they still say that they doctors still will minimize. Like it's just ridiculous. Okay. But again, what you guys are so you're coasting on this sort of propaganda and this cultism, this cult blindness. Like, I wonder if like these people, these engineers of all this, are like knew that, or was that just a side effect of academia? Because I know that they were like, ooh, at least they were like, ooh, this is an interesting side effect. Let's encourage this. Let's enhance it. And then you get shows like Grey's Anatomy, which is like I feel like it's like medical propaganda because it's nothing like that. Doctors are not like that. Like we're the constantly show make a show about medical professionals, but the doctors are constantly they see you as an insignificant inconvenience who just miss and minimize everything that you're experiencing. That would be a realistic show, not this super rare condition. No, make a show where they're treating the same 10, 15 conditions 98% of the time, 98% of their career. That would be more realistic. So, because of this, how are you so ignorant, arrogant, and dismissive and snobby? Is it because you've been gassed up by this caste system? Because it just it's like a dread going to see doctors. You just anticipate um being dismissed, being treated like an inconvenience. And then you get like how dare you challenge me type of thing, and where those sprouts start sprouting techno babble at you to sort of like I don't know degrade you and make you feel like inferior. I guess very common tactic. Like I don't care if you're throwing out techno babble. I don't give a crap. Well, I do, but like and then it's just this engineering where it's like I also feel like this is like the education industry where we're sort of conditioned to be obedient and compliant to authority figures. Like the education system's not about educating people, right? It's about turning us into like compliant, obedient, robotic parrots. And that's how we're sitting in these places because it's an authority figure. Like doctors are not our authority figures. I'm like hyping myself up to say like they're our coworkers. Like this is not like some loving community world we're living in. This is a very corrupt world, a very sinister world. So I think it's better for us to approach this like it's all business. They're not superior. They're not authorities. They're not above us. We're equals, and they're coworkers. I'm paying you. You're paying me. It's a transaction. It's business. um, you're my coworker. I can talk. I'll take as long as I want. I'll take as long as I need. I'm gonna ask questions because it's my life. It's my body. And these doctors are not liking this, but I think we need to continue it because why are we? These are overpaid snobs, arrogant for no reason. Tell me what the hard part is about being a doctor. What's the hard part? Like you can say like fruit pickers. That's like a menial job. Like it's in the hot sun, so that's like working with those conditions. You have to use endurance and stamina to pick it, physical strength. It's wearing your energy. Um, right? You can describe what's hard about being a fruit picker. Describe what's hard about being a doctor. And then you can even get into things like surgeons. It's like it's not that amazing. Yes, it's even that. Yes. People try to hype and romanticize surgeons like they right hype and romanticize servers. A lemur could be a server. Please can we please stop hyping and romanticizing server? That's another video idea. Please stop doing that. It is amazing, but it's not super amazing. Like it's like they're body mechanics. It's like a car mechanics, it's a body mechanic. Okay? And they constantly make mistakes, leave things inside of your body. And then there's this even issue where this is an artificial construct. It's not real. Like I want a barber to perform my surgery. Does someone see where I'm going with this? Have you seen some of these barbers' precision? Like, okay, you can memorize factoids very well, but how's your hand-eye coordination? How are your reflexes? That's a huge part of being a surgeon. Like, I want some of these barbers to be my surgeon. I trust them more than you. So maybe some of them can't memorize these sort of very technical factoids very well. Who cares? It's actually more visual than memorizing trivial factoids. Right? I'm just saying, like, there's multiple types of intelligences. It seems like the wrong intelligences are in these professions. It's like this logical hierarchy or something. Like, I want someone with a higher creative intelligence, a higher intuitive intelligence, a higher practical intelligence. But it's like people with high social intelligence and logical intelligence are becoming doctors. Or maybe it should be like a team. Because logic, it makes you observant and helps you memorize all this information, but there's something missing in this pie. It's missing in this equation. Like people with high practical intelligence have that sort of good, I know, almost that athleticism, and and then that creative intelligence helps them do all those designs. Like you need that to that would help being a surgeon doing surgeries. But then these people just have high logical intelligence, which is why there's some of these issues coming out. Who cares if they don't can't memorize an unum oblongata, whatever? Who cares? You do this. If that happens, and you do this. If you do that happens, and you do this. That's what it is. It's like this mechanical knowledge, like car mechanics, because they can't pass these high logical intelligence hoops. They can't become a surgeon. Like, I mean, you see that everywhere. It's like there's people who are born naturally athletic, but then it's like these. But then look at some of our firefighters. Like I mean, like our system sort of exploits that by like arresting these people and then paying them $2 to fight wildfires, like in California. Like, then why don't you just hire them in the first place instead of like kidnapping people for labor? Like, but yeah, back to the more snobbiness and like arrogance. It's like, where do you get off? Like, you don't even register us as human beings. Like, and that's another thing. It's like, this is a good sort of experience to show that you can't, even in your high pay, you can't handle it. You can't handle the money. You're money addicts. It goes to your head, it's distorting your self perception. You guys have these deity complexes because of the money. You are rigging the system because of the money, like keeping the supply of doctors low, which is impacting us also horribly. Like that impacted the pandemic. Like we wanted this like bare bones type of medical industry because it maximized profits. But then look what happened during the pandemic. We had undersupply of this and undersupply of that. And then another thing, it shows that these people are not as impressive as we believe because why didn't you guys have supplies? Like you weren't aware that you didn't have supplies. Like what's going on here, really? But then also the more sinister stuff. Have you guys been like given procedures you haven't needed, testing you haven't needed, total negligence in care? That's what these doctors are doing too. But you guys feel sort of entitled to do it because of this sort of deity complex, this sort of cult around you. Like it seems like you don't need a humble pie. You like need a humble anvil. And I don't really care. It's like sell one of your three houses. When your pay gets docked, sell one of your three houses? How is there a homeless epidemic and you have three houses? How do you have a house you only reside in 3 months out of the year while there's people sleeping on the streets when your job is not hard and you're only highly paid because the system is rigged, which you want to cherry pick?